my name is Tess Coker. I'm a GI fellow at Washington University, here to talk a little bit about the Kasai procedure. The Kasai, or Kasai portoenterostomy, is the mainstay in surgical treatment of biliary atresia. Biliary atresia, also known as BA, is a problem with bile flow diagnosed in early infancy. Typically, bile flows from the liver through the bile ducts or biliary tract and into the small intestine. This allows the bile to be excreted through stool. In biliary atresia, this flow is interrupted, which causes bile to build up in the liver.
Shown here is an illustration of biliary atresia. The green arrows represent normal bile flow from the liver through the bile ducts and into the small intestine. The red X's represent blockages from biliary atresia, which can happen anywhere in the bile ducts, in or outside of the liver.
Bile built up in the liver in the long term can cause damage to the liver and even scarring, called cirrhosis. The mainstay in treatment for biliary atresia is surgical correction with a Kasai procedure. In the Kasai, a portion of the small intestine is brought to the liver and surgically attached to the liver to allow bile to flow more freely.
Shown here is an illustration of the Kasai procedure. As you can see, a loop of small intestine is directly attached to the liver, allowing bile to flow directly from the liver into the small intestine.
This is done in a hospital setting and may require monitoring in the hospital or even ICU afterwards. The Kasai procedure may have varying levels of success in reestablishing normal bile flow. No matter how successful the Kasai procedure is, children with biliary atresia will still need close follow-up with a provider who specializes in liver care. Bile is essential in helping the body absorb necessary nutrients, so patients with biliary atresia may be long-term on supplements, vitamins, or even special formulas to help with nutrition. They may also require antibiotics to prevent infections of the bile tract, also known as cholangitis. Ultimately, the vast majority of infants with biliary atresia will go on to need liver transplantation. For some, that may be many years down the road, but for about half, that occurs in the first 2 to 3 years of life. No matter the outcome of a Kasai procedure, children with biliary atresia will be followed closely by providers with knowledge in liver disease and nutrition. Thanks for listening, and I hope you learned a little bit about the Kasai procedure.